General anatomy. Anatomy is the science of the structure of the body. The word is derived indirectly from the Greek word anatome, composed of ana meaning up and tome meaning to cut open. Anatomy is generally divided into macroscopic or gross anatomy and microscopic anatomy or histology. In general, the theory dealing with human anatomy either goes systemically, that is, according to the various systems of the body, such as the skeletal system, the muscular system, the digestive system, etc., or regionally, that is, according to the natural main subdivisions of the body, such as the head and neck, the upper limb and thorax, etc. The regional plan has been adopted widely in medical schools to keep pace with the dissection procedure. Regional anatomy. For descriptive purposes, the entire structure of the human body is divided into different regions: the head, the neck, the trunk, which includes the thorax and the abdomen, a pair of upper limbs, a pair of lower limbs. Anatomical position. All descriptions in human anatomy are expressed in relation to the anatomical position, wherein the body is erect, with the head, eyes, and toes directed forward, and the upper limbs are held by the side so that the palms face forward. This is also known as the supine position, the opposite of which is the prone position. Clinically, the patients are frequently examined in the supine position. Anatomical planes are 3 in number. The median plane. It is an imaginary vertical plane of section that passes longitudinally through the body and divides it into the right and the left halves. The median plane intersects the surface of the front and back of the body at what are called the anterior and posterior median lines. It is a common error, however, to refer to the midline when in fact the median plane is being referred. The sagittal plane. Any vertical plane through the body that is parallel with the median plane is called the sagittal plane. The sagittal planes are named after the sagittal suture of the skull, to which they are parallel. The term parasagittal is redundant. Anything parallel with a sagittal plane is still sagittal. The coronal plane. Any vertical plane that intersects the median plane at a right angle and separates the body into anterior and posterior parts is termed a coronal or frontal plane. Anatomical terms. Transverse, meaning at a right angle to the longitudinal axis of a structure. A transverse section through the hand is horizontal, whereas a transverse section through the foot is coronal. Medial, meaning nearer to the median plane, and lateral, meaning farther from it. Thus, in the anatomical position, the thumb is lateral to the little finger, while the big toe is medial to the little toe. Anterior or ventral refers to the front of the body. In the upper limb, the term ulnar refers to the anterior position, while posterior or dorsal refers to the back. In the foot, plantar refers to inferior, while the term dorsal is commonly used to refer to the superior part in the foot. The term superior refers to cranial or cephalic, which means towards the head region of the body. An inferior or caudal refers to the region towards the foot of the body. The terms proximal and distal are used to indicate nearer to and farther from the root or attached end of the limb, respectively. Internal and external mean nearer to and farther from the center of an organ or a cavity, respectively. Superficial and deep, nearer to and farther from the surface of the body, respectively. Medial is the term used for a structure lying between two others that are anterior and posterior, or superior and inferior, or internal and external. Rostral means cranial or cephalic. The term intermediate refers to lying between two structures. For example, the heart lying between the lungs. Movements of the human body. Flexion and extension. Flexion refers to the bending movement around a joint in a limb that decreases the angle between two body parts. Flexion at the elbow refers to the decreasing angle between the ulna and the humerus. When the knee flexes, the ankle moves closer to the buttock, and the angle between the femur and the tibia reduces. Extension refers to the movement that increases the angle between two body parts. Extension of the elbow increases the angle between the ulna and the humerus. Extension of the knee straightens the leg so that the thigh and the leg are in straight line. Abduction and adduction. Abduction is a movement away from the midline, just as abducting someone is to take them away. For example, abduction of the shoulder raises the arms out to the sides of the body. Adduction is a movement towards the midline. For example, adduction of the hip squeezes the legs together. In fingers and toes, the midline used is not the midline of the body, but of the hand. Adduction of the thumb. The thumb comes into close contact with the lateral side of the index finger. Abduction of the thumb. The thumb is moved vertically at right angles to the plane of the palm. Flexion of the thumb. The thumb is moved across the palm. Extension of the thumb. The thumb is taken backwards in the plane of the palm and the foot, respectively. In fingers and toes, the midline used is not the midline of the body, but of the hand and the foot, respectively. The line of axis passes through the middle finger in the hand and the second toe in the foot. Therefore, abducting the fingers spreads them out. Medial and lateral rotation. Rotation is the movement of a part of the body around its own longitudinal axis. In the limbs, movement of anterior surface medially is known as medial rotation, and the movement laterally is known as lateral rotation. Medial rotation is a rotational movement towards the midline. It is sometimes referred to as internal rotation. To understand this, we have two scenarios to imagine. First, with a straight leg, rotate it to point the toes inward. This is medial rotation of the hip. Lateral rotation is a rotating movement away from the midline. This is in the opposite direction to the movements described above. Elevation and depression. Elevation refers to the movement in a superior direction. For example, shoulder shrug. Depression refers to the movement in an inferior direction. Pronation and supination. This is easily confused with medial and lateral rotation, but the difference is subtle. With your hand resting on a table in front of you and keeping your shoulder and elbow still, turn your hand into its back palm up. This is the supine position. This movement is therefore known as supination. Again, keeping the elbow and shoulder still, flip your hand into its front palm down. This is the prone position, and hence this movement is named pronation. These terms also apply to the whole body. When lying flat on the back, the body is supine. When lying flat on the front, the body is prone. Dorsiflexion and plantar flexion. Dorsiflexion and plantar flexion are terms used to describe the movements at the ankle. They refer to the two surfaces of the foot, the dorsum, superior surface, and the plantar surface, the sole. Dorsiflexion refers to the flexion at the ankle so that the foot points more superiorly. Dorsiflexion of the hand is a confusing term and so is rarely used. Plantar flexion refers to the extension at the ankle so that the foot points inferiorly. Similarly, there is a term for the hand which is palmar flexion. Opposition and reposition. A pair of movements that are limited to humans and some great apes. These terms apply to the additional movements that the hand and the thumb can perform in these species. Opposition brings the thumb and the little finger together. Reposition is a movement that moves the thumb and the little finger away from each other, effectively reversing opposition. As we start dissecting the body, we come across various structures. Anatomical structures. The following are the structures that we come across during anatomical dissection. Skin. The superficial outermost layer and the largest organ of the body with a total area of about 20 square feet. The skin protects us from microbes and its elements help in regulating the body temperature and permitting the sensations of touch, heat, and cold. Fascia. A fascia is a band or sheet of connective tissue, primarily collagen, beneath the skin that attaches, stabilizes, encloses, and separates muscles and other internal organs. The fascia is classified by layer as superficial fascia, deep fascia, and visceral or parietal fascia, or by its function and anatomical location. Vessels. The blood vessels are the part of the circulatory system that transport blood throughout the human body. There are three major types of blood vessels. Arteries, which carry the blood away from the heart. Veins, which carry the blood from the capillaries back towards the heart. Capillaries, which enable the actual exchange of water and chemicals between the blood and the tissues. The word vascular, meaning relating to the blood vessels, is derived from the Latin word vas, meaning vessel. Lymph. A vein-like vessel conveying lymph in the body. As part of the lymphatic system, the lymph vessels are complementary to the cardiovascular system. Nodes. A lymph node is an oval or kidney-shaped organ of the lymphatic system, present widely throughout the body, including the armpit and stomach. They are linked by the lymphatic vessels. The lymph nodes are major sites of B and T lymphocytes and other immune cells. The lymph nodes are important for the proper functioning of the immune system, acting as filters for foreign particles such as bacteria and cancer cells. Nerves. The spinal nerve is a mixed nerve which carries the motor, the sensory, and the autonomic signals between the spinal cord and the body. In humans, there are 31 pairs of spinal nerves, one on each side of the vertebral column. The cranial nerves are the nerves that emerge directly from the brain, including the brainstem, in contrast to the spinal nerves, which emerge from the segments of the spinal cord. Cranial nerves relay information between the brain and the parts of the body, primarily to and from the regions of the head and neck. Muscles. A muscle is a soft tissue found in most animals. Muscle cells contain protein filaments composed of actin and myosin that slide past one another, producing a contraction that changes both the length and the shape of the cell. The muscles function to produce force and motion. They're primarily responsible for maintaining and changing the posture, locomotion, as well as movement of internal organs, such as the contraction of the heart and the movement of food through the digestive system via peristalsis. Tendons. A tendon or sinew is a tough band of fibrous connective tissue that usually connects a muscle to a bone and is capable of withstanding tension. Anatomy of ligaments. A ligament consists of fibrous connective tissue that connects bones to other bones and is also known as articular ligament, fibrous ligament, or true ligament. Bursae. A bursa, plural bursae or bursas, is a small fluid-filled sac that provides a cushioning between the bones and tendons and or muscles around a joint. This helps in reducing friction between the bones and allows free movement. Bursae are found around most major joints of the body. Bones. A bone is a rigid organ that constitutes a part of the vertebral skeleton. Bones support and protect the various organs of the body, produce red and white blood cells, store minerals, and also enable mobility as well as support for the body. The bone tissue is a type of dense connective tissue.